Wellbeing Board, I think we've gone through quite a wide-ranging level of experiences over the past few months as the board itself and as partners. And I think the work we did over the last 18 months has got us, the partnership arrangements we put in place and those discussions we've had has made us a lot stronger to get through the COVID pandemic so far. We know we're getting the pandemic started to come back again. I think this meeting today is quite timely, that it gives us the time to, through the reports, reflect around what we've done jointly, but also how we can work together going forwards. So I would ask when people do speak, that they introduce themselves so we know where they're from. I'd also ask you to refer you back to the protocols we're using for holding the public meetings, the virtual meetings. If members of the committee, which is the voting members as such, if you could leave your videos on at all times, but please, for everyone, can you please ensure that you put your microphone on mute unless you're speaking. On your basis, we don't want the mobile phones in the background ringing. It does sort of interrupts the whole process. If there's any technical problems with the meeting, then we will pause it until they're resolved. And if a member loses connection, the meeting will adjourn until reconnected. When I say that, it's just to make sure we've got the right people in the room making the meeting. And if they persist, then we might have to, or if it becomes incorrect, then we might have to rearrange the meeting. I hope that doesn't happen, but just let people know. To go by the clock on members' personal computers, which is the UK time, it's now 12:33, and just to let you know that the meeting is being video and audio recorded and will be available to watch and listen on the council website, and will be available all in good shops soon. But I just think to reiterate that point, you know, that we've gone through a lot over the last 6 months. And I think, you know, we'll probably look back that it's gone quite quickly, only because we've been working so hard. And I do believe that it is those relationships where we can sort of pick up the phone and talk to each other, rather than trying to send very lengthy emails trying to explain something, that has broken down some of the barriers that some other places in the country have seen. You know, that we've been able to sort of get through a lot better than we could have done. So can I ask if any reserve members are present? I haven't been notified of any, and I think everyone is on the call. The appointment of vice chair. So we note the appointment. I'll just ask if we can note the appointment of the chair of the Harrow Clinical Commissioning Group as the vice chair of the board for the 2020-21 municipal year. We haven't had a meeting since the council meeting back in February, I think. So that is Genevieve. Is that agreed? So Genevieve is the chair of the meeting. She's not here at the moment, but she will be along soon.
I think she is on the call, actually.
Hi, Graham.
Oh, welcome, Jen. I didn't see you on there. I was going, the list is quite long, but I didn't see you there. So
Thank you very much.
So congratulations, Genevieve. You're the vice chair of the Health and Wellbeing Board. Declarations of interest. A form did go out to ask anyone if they had any declarations of any items on the agenda. That has been published on the internet. If anyone becomes aware of any pecuniary interest while the meeting is taking place, if you could let us know, we can make a note at that particular time. The last meeting we had was on the 14th of January 2020. They have been published. Can I just take them as being an accurate record of the meeting? People are nodding assent. I don't see any dissent of that. Thank you. Item 5 is petitions. None have been received. Are there any petitions? No. Thank you. Public questions, we have received none. Deputations, we have received none. I'll just pause for a moment before we move on to the out of hospital plan. Now we're in the formal part of the meeting. we are seeing a lot of announcements being made. We know the Prime Minister is going to make a statement this afternoon and to the House of Commons, and also a further statement tonight. And as you've seen a lot in the press over the last few days. Paul, would you want to comment at this stage, or do you want to comment a bit later?
Probably comment a bit later. Carol is on the call, so I don't know in terms of the latest data whether you wanted to have that at this point or not, because that is what is going to drive the Prime Minister's announcements to some extent.
Carol, are you in a position? I'll just check with the board. It is a change to the agenda item, but I just think that with the information available, can we invite Carol in to make that sort of presentation about the up-to-date figures, so people can get a bit clearer understanding of why decisions are being made at a national level? Is that agreed? Thank you. So Carol, did you want to comment?
Over the last 2 weeks, we've had 140 cases. The numbers this week look better than last week, but it is really to be taken with a little bit of a pinch of salt, because there have been national problems with the testing of people in Pillar 2. A lot of the testing has been diverted to the north of England, where they were experiencing a lot of outbreaks, and as a result, we've not had a lot of testing happening in London and the southeast. So we do think that the numbers are a lot higher in London than the published figures actually show, and that's what's really sort of heading up our concern. What's being discussed at the moment nationally is around what we can do to try and get on top of this increased risk, because we've gone to a level 4 from level 3, which means that we're in an increasing epidemic. And there's also discussions about what we can do in London, that's in addition to what's happening nationally. And none of that's been finalised yet, but as soon as it is, we'll be sort of making people aware of what that actually means. But in the meantime, we're just sort of encouraging people to isolate if you've got symptoms, try and get a test, and hopefully you'll be able to get one. I think, you know, that social distancing, mask wearing, hand washing and sanitising, I think have all got to be our messages. Face, space, wash your hands. I can't remember what the other one is. So I think that's really what the messages are. We are seeing slight increases in the number of people going into hospital, but still the majority of people that we know that are getting tested who are positive are in the under 65s. I think that's all I've got to say, Graham.
Thank you, Carol. Just to add one point, I was on a call yesterday with Public Health, and one of the key points they're putting out is that London is the densest part of the by population region in the country, but we're showing significantly lower levels of infection, and that is what's given rise to major concerns about the data being slightly incorrect. I wouldn't say it's wrong, but it's so they've tested across other areas to find out how far they believe it's has gone through the system, and that is what is given us rise to concern. But we will come back to this later in the evening in the meeting if we can. Thank you. So if we move on to item 8,
Sorry, Graham, there's a hand up from Simon.
Oh, sorry, I didn't see that. Simon.
Hi, Graham. And for those of you who don't know me, I'm Simon Crawford, Director of Strategy, Deputy Chief Executive, London North West. Just in terms of the hospital, just in terms of admissions of COVID positive patients, we're up to 14 at Northwick Park now. That's the highest we've been for some time. But our underlying level over the summer months was five or six. We've always had about 5 or 6. So it is an increase. It's not a massive increase, but I suppose it's significant in the sense it's gone from about 6 3 or 4 weeks ago to 8 to 10 to 12, and now it's at 14. So I just thought I'd share that with you. But none of those are requiring mechanical ventilation at this point of some. Some are unwell, and we've got 3 in HDU, but we've got 14 in total.
Thank you, Simon. Yes, that's very useful. I did forget about the people going into hospitals. There is people going in. They're doing a lot of tests through there. Just on, as we move into the reports now, these are joint reports, which I'm really pleased about. It shows the work that's taken place. So we will have a number of people speaking on the reports. If anyone would like to ask questions or make comments on the report, could they use the raise hand function within the Teams system if possible? So this report, the out of hospital plan, it's in the name of the CCG. Is Javina moving this one, Paul?
Well, Javina and I will do this together, and I'll probably start off. I know Javina's just been on another intense meeting, so I'll give her a slight breather here. But just to remind everyone on the call that our out of hospital plan has been to the overview and scrutiny panel. It is a dynamic plan. It's not something that's static. And we have been really working hard as a health and care executive to make sure that we respond to the learning from the first wave of the pandemic, but also that as systems leaders, we react to the obstacles, the issues that arise across the system. We've got a very comprehensive set of work streams that sit under the out of hospital plan, and it's very, very detailed, and at its core it is about integrated health and care and partnerships working together. And I can honestly say that the pandemic has certainly brought together the borough partnership in a very profound way. And it has, I believe, made a difference to the good folk of Harrow, and it's something we should, even in the grimmest of times, be proud of and celebrate. So there's quite a lot of detail in there, and we have taken on board some of the feedback from overview and scrutiny, and we are always trying to develop and improve this. It's not just a document, and it really is something live that is being implemented as we speak. So, and the health and care executive oversees this plan. It does have interrelationships with what's happening across northwest London, and I think that's one of its strengths, that it does make reference always to the partnership, the partners on the ground, and in particular primary care networks, which at our last health and wellbeing board were relatively new, and we had a lot of questions about how they would function and whether they would make a difference. I think I can honestly say that at the heart of our out of hospital plan, the primary care networks have done really well and are strong contributors to this plan. So I'm not going to go into the details. It's a very long plan, and it's detailed, rightly so, but I'll hand over to Javina to see whether she wants to add anything further.
Thank you, Paul, and thank you, Chair. So just to reiterate that Paul and I are here to present this on behalf of the whole of the Harrow Partnership. I'm really pleased that we have Simon and maybe Tanya with us, but there are other members of the Harrow Executive Partnership that aren't here, so our collective thanks to the group. Just a couple of things to kind of point out before I invite Aya to take us through some highlights of the implementation plan. I just wanted to mention three particular things that we put together, which we have really worked hard in terms of our joint offer to the Harrow communities and residents. The first is really the establishment of the Escalated Care Hub, also known as the HOT Hub, which operates from the Alexandra Avenue Health Centre, providing support to symptomatic patients so that they could be triaged and tested. And along with that, as we discussed at the ASK, it has supported us in providing several other services really to give an increased offer. And so we're very grateful for that. We have developed a local testing model that has provided a rapid response testing service for and not only just Harrow and our care homes, but other care homes in neighbouring CCGs and other parts of northwest London, and also for testing outbreaks locally. And lastly, an enhanced care home service model, which has ensured that we have been able to provide both geriatric and palliative care support, in addition to community support. And this model has been taken further and developed in other parts of northwest London. And as part of this, we have quite a comprehensive care home support offer. And I could say that we're probably the only SDP who offers this as compared to other parts of London. So just to give a few key principles where the partnership has really come together, and we are using and building these principles in terms of developing the work moving forward, in trying to address issues that we think we can expect as part of Wave 2 and then in terms of our future work. So as Paul has said, the partnership has come and worked together as one, irrespective of organisational boundaries. And actually, it would be fair to say that this has really been the positive aspect of the pandemic for us in Harrow. And we truly must celebrate that because, you know, we've come leaps and bounds in that. I would say extremely close working relationships amongst all partners, but particularly the local authority and CCG, and that really has an impact on the care that we deliver because it is truly holistic, looking at patients' health and care requirements. The NHS has really come leaps and bounds in trying to embrace the benefits of digital and online video consultations. And in doing so, we have also recognised that there is a downside to this, particularly with digital inclusion. And so we're trying to balance those offers to make sure that we can provide an appropriate offer to all our patients and communities. A real focus on reducing inequalities given the makeup, the ethnic makeup of Harrow, but also the disproportionate impact that we have seen on our communities. And so we're doing quite a lot of focus work on this. Some recent examples are some focus work with the Somali and Tamil communities. Work around prevention and self-care with our communities. I'm very grateful to our voluntary sector partners who have taken the lead role, and my thanks to Alex, who's been really pivotal in taking these conversations forward along with Mark Gillam. Primary care networks, of course, we're really grateful to our support from our clinical directors and all of our partners as part of the PCNs in taking the forefront in terms of developing patient-centric personalised care and with a view to reduce dependency on the acute hospitals. So I guess the next part of our journey is really to make sure that we build on these principles and deliver the out-of-hospital implementation plan. But I think in the here and now, the focus along with that is very much about taking our communities on this journey with us, really trying to understand what their anxieties and fears have been in Wave 1, how we can assure them moving forward and build their confidence in an impending wave that might come so that there isn't any break in continuity of care. and that they're kept safe at all times. So with that, please allow me to invite Aya to take us through some highlights of the implementation report.
Thank you, Javina. Thank you, Chair. My name is Aya Adekoya. I'm the Programme Manager for the Integrated Care Programme in Harrow. Yeah, so as Javina and Paul have mentioned, we sort of got to the point where we've got an out-of-hospital recovery plan on paper, and we have had to move from it being on paper to actually implementing it. So we needed to put some programme structures in place to aid the delivery. We developed a 100-day plan to enable us to do this, and we've actually enclosed in the papers a summary pack of the implementation plan, and that just gives us some more detail around how we're working towards delivery. I'll just quickly run through the highlights sort of over the 7 or so of those slides, just to give you a feel for how far we've got to. So slide 3 just shows the current governance structure of the Integrated Care Partnership, and it includes the reporting links, the escalation routes for any relevant risks and issues. We've got a partnership forum now that we are developing. It's a developing forum because we've sort of shifted from what used to be a sort of provider management group into something that will be a partnership discussion group for themed discussions around things that the sort of operational leads feel are relevant to that moment in time, that they really would like to either make connections around or try and tackle. So for example, tomorrow we're having a discussion around winter and future COVID surges. Slide 4, the next slide, shows the 100-day plan, which I referred to just now. And this has helped us to put these structures in place and the mechanisms to go from planning the recovery into how we're actually going to start to implement it. So the main areas of focus for the 100-day plan were around the design, the leadership, the governance, the culture and behaviours that we would like to see, and of course the management structures around the work streams. It was split into a sort of 3 months, which are highlighted on pages 5 to 7. I won't go through the detail, but those pages show the progress made in terms of the activity and the status of each of those activities. We came to the end of the 100 days this month and made very good progress actually with all the elements around that. Just moving on quickly, slide 8 just shows the areas of focus and the steps that we took to deliver that. So there are probably about, I think, 10 or 11 steps around that. So we had to prioritise the work streams, which Javina's referred to. So there are 9 sort of model of care work streams, and there are 3 enabler groups, which include education, digital transformation, and comms and engagement. We then sort of have got senior responsible officers now for each of those work streams, and they're from across the partnership. We've got CCG management leads supporting the work streams, and also CCG clinical directors supporting the work streams. Each of the model of care work streams also have PCNCDs as joint SROs. And each of these work streams have started to meet regularly. They've developed terms of reference, what the expected outcomes are, and also the work plans for delivering the out-of-hospital recovery plan. And now we're working through all the details of any gaps that are being identified, either in terms of delivering the models of care or connectivity or any interdependencies, and of course around capacity and resources. And finally, the last 2 slides just give some details around each of those work streams and other priority areas that were highlighted on the recovery plan. So that's a very quick canter through those slides, just to give you a feel for how much work we've been doing over the last 3 months. Thank you, Javina.
Thank you, Javina and Paul. Was there any questions? Christine, you have your hand up.
Couple of tiny questions, but first of all, just to say how wonderful this is. You know, it's fantastic that this is a joint report between the local authority and the CCG, and it is wonderful, you know, having had the privilege of being on this board for a few years, to see the progress that you have made, that we have made. I mean, I just applaud you all. What I'd like do is just, I'm going to be a bit twitchy here. I'd like to go back to your original principles, shared principles, which I also applaud. And I think it's wonderful to see that written down. And to know that so many things are going forward on what I would call a primary care level, and so many other things that we know about, like the wonderful thing that CNWL is planning, which is the mental health support teams. But there are two particular questions I've got. Don't need to be answered now, but I just want to raise them, and perhaps they might come up later. I mean, I think it's great that children's mental health is mentioned in the principles. And, obviously, because of my past life, I'm thinking of that in terms of out of hospital care, because really that's part of the wider picture. And, my previous memories are, and I don't think they're that out of date, is that sometimes the CPA and the discharge process would be a bit hurried. And that how difficult it is when especially you have to find specialist placements for young people out of the immediate range of the borough. So I would just really like at some point, but not now, just an update on how that's working, because that's a specialist group which also needs out of hospital care. And the second one is a query about, have we made a lot of progress now with incorporating paediatrics, hospital paediatrics, into our wider what's that horrible word, dashboard, because at times that has been a slight difficulty. And I'm talking about the process of actually incorporating them into the general planning and thinking. I know that the SALT and the OT teams work well, sadly restricted by lack of funds, but everybody locally working hard on that. So I just have those two queries, and that could be an email at some point. I'm just raising them as specialist areas, which I'm sure in principle are included in everything. And once again, thank you for all that you've done. Thank you.
Thank you, Christine. Next person is Janet.
Thank you very much. I'd just like to echo what Christine said. Absolutely super. We're agreeing for once again. The other thing I wanted to say was that on number 8 about culture and behaviour. Now, I don't know whether it's appropriate to mention it in this instance at all, but it's been, I've had people mention to me about the group of 6. And unfortunately, fortunately the weather's been really good, but over the weekend from Friday to Sunday, it's been mentioned to me that groups of ladies have met together with their children in the parks. And I wonder if that could be something that perhaps the leader could take up, or perhaps we could have signs in parks to say that we need groups of 6. Which I think is very important. Unfortunately, I don't think that some people realise that children are included in the 6 people as such. But I'd like to thank you again very much for the report. Thank you.
Thank you, Janet. We'll pick up a few of these points at the end, which will make it easier. So going backwards and forwards through questions and answers. And I'll pick up the point at 6 at the end if no one else does. The next person is Gazumfa.
Thank you, Chair. First of all, my appreciation for this very, what should we call, extensive report. I'm sure you everybody must have put a lot of work in there. My question, I want you to understand. To implement this care plan, just if could you give me any example if somebody has suffered from COVID-19, and how are you going to implement your care plan?
Thank you, Kazan, for that. We'll pick that up as well. Genevieve.
Thank you very much, Graham. Maybe can I just try and answer the councillor's point there in the first instance, just in terms of I think the word care planning is used throughout, not just for those people who have COVID-19, but actually across the broad spectrum of lots of conditions. And we're used to using care planning for some of our more frail residents, for our more complex residents, and we know that patients who have been shielding require care planning in terms of coordinating all the different aspects of their care. We know that with COVID-19 there is this concept now of long COVID, and the concept of needing ongoing rehabilitation, and that is something that we are looking at, how we develop our services to meet those emerging needs. It is difficult because we're only discovering the needs now as people go on and recover. So I think that we're not particularly, when we're using care planning in this instance, just focusing on COVID patients, but also the entire spectrum of people who've got needs. So maybe that helps in part to answer your point, but others may want to add later. Excuse me. I've obviously spoken too much this morning already. The point that I wanted to make was really around the hard work that everybody has done in this plan. But more than that, I think we're so used to seeing plans that sit on shelves and actually don't actually develop into changes in activity and behaviour. And actually what we see in this plan is, as Paul said, an iterative dynamic document which actually has guided Harrow across quite a few months now. And I think that that's really quite exciting. And the reason that it's happening is because of the very hard work of everybody in this incredibly busy time to their commitment to the Health and Care Executive. And I want to pay tribute to Paul and Javina here in terms of the way that they are driving the work through that executive to actually really deliver the outcomes that we are beginning to see. It's a very exciting time for us in Harrow. We all have lots of memories of history, but we're actually making a new history now, which is actually how we are working together for the benefit of the residents of Harrow. And if that's a lasting legacy out of this horrible disease, then actually we will have achieved a great deal.
Thank you, Dr. Small. My only concern was because we are almost in a second wave, and Harrow being a very diverse community, and during the last, when the epidemic started, most of Asians origin, and they suffered the most. And Harrow, I think, a couple of weeks, they were said number 4 in London. So this is where my my main concern was on COVID-19. So this is where we have to be really alert all the time. Thank you very much. Thank you.
Yes, thank you, Cassandra. We're also going to come back to this point a bit later on the agenda as we talk about local outbreak plans, because Carol will give a bit more detail around what we're also going to be doing to extend that. John Higgins.
Thanks, Chair. I echo what others have said about the comprehensiveness of the report and how it feels very, very joint. I suppose I've got a couple of points. One is that one of the issues that you've raised before about the strength of partnership, that that came through very, very clearly over the development of the response to COVID through the voluntary sector, both working across the voluntary sector, faith groups, local communities, but with both the CCG and the council. And I really think that is again something to herald as something very good that we'd want to build on. I suppose I've got one specific question around the work streams, and what was the decision about having care as part of the prevention, self-care and social prescribing work stream? Because arguably COVID has led to even more pressures on carers. So would there not be a case for having carers as a specific work stream and therefore a specific priority?
Thank you, John. Javina, did you want to sort of catch up and go through some of those questions, answer some of those questions? And then Carol will come in and pick up some of the other points.
Thank you, Chair. I'll come in and address them. I might invite Angela to specifically add some more information about carers, if that's okay. So thank you to Christine for raising those two really important questions. I will write to you and give you the information that you're seeking, and hopefully you will be assured. But just for the here and now, just to let you know, within the North West London work, we're trying to make sure that we pick up all of the interdependencies, and so the mental health, learning disabilities and autism programme is interlinking with both the out of hospital and the children and young people work stream, and so this is very much a hot topic of conversation. In terms of your question in relation to the hospital paediatrics, again the same, and we're trying to make sure that we have all of the aligned information right from critical care to all aspects of work that we're doing, and this was very much a discussion as part of the ICS meeting at North West London yesterday, so I will come back to you in terms of that. In terms of John's question in relation to carers, thank you for raising this, John, because the Health and Care Executive had quite a lot of discussions about this, because I think we all feel very strongly about the need to ensure that carers are not left out from all of the discussions. And whilst we think of carers implicit in all of our work streams, we felt that there needed to be a piece of work that we could look specifically at all of the things we needed to do for the here and now. And with that in mind, we created a subset, which Angela might be able to talk about a little bit more, because she was actually in those meetings, along with Mark and others. So I think we're waiting to see what the output of that discussion is, to then agree what next steps are going to be. But I think the focus is very much about recognising both the support, which is absolutely invaluable, that the carers provide, and ensuring that as part of this, they're not overseen or forgotten about, that their needs and priorities are very much at the forefront, as well as the people that they're caring for. So I don't know if Angela might want to provide a little bit more information.
Yeah, thank you, Javina. So it's just really to reflect that point, I suppose, John, in a sense that it was hugely apparent very early on, given the numbers of carers that we have in Harrow and how valuable their work is. And actually, quite often carers will be often doing that duty without actually having many services around them to support them. So it kept on coming up in all the meetings, and we felt that there needed to be a separate group to look at those needs, and so you've got people from CCG, the voluntary sector is involved, and obviously the council, looking at how we can look to support them, and how that is going to change actually as the duration goes on, and the situation becomes much harder to try and ensure that we can support them through that and prevent breakdown.
Thank you, Angela. Carol, did you want to come back in about those other points that were raised now, or did you want to do it in your presentation later?
If I can pick up the COVID points later, and I was just going to say what Javina and Angela had said about carers, so I put my hand down, so I'll pick the other stuff up later.
Thank you. I can't see any other hands on the report, so I'm switching between machines. The new technology means you have to move around a bit, but I'm switching around a lot of machines here. The recommendation is to note the report, but I think we should also really note that the work that is taking place is an exemplar for others to follow. I don't say that of any other sort of thing, but I've mentioned this. I'm also the chair of the is it the North West London CCG temporary, the 8 boroughs, and we talk about this all the time about how it can work when it works well, and they use this as an example of how things should work well. So thank you to everyone who's involved, and there's, as John says, there's a number of partners that I haven't mentioned so far, but there's a lot of people involved with this to make it work, and I think it's a good example of how we are moving forwards. So can we note the report as we stand today? Everyone's nodding yes, so that's very good. Now move on to page 73, which is the care homes and support plans and implementation. This is what I like. There's another joint report. This is from Javina and Angela, I believe. Who would like to go first?
Thank you, Chair. I think I'll defer to Angela to introduce this report. I've already made reference to the Sterling Care Home work that we've done in the earlier discussion. So I'll let Angela come in. Thank you.
Okay, thank you. So another critical area, sadly, we saw at the beginning of the pandemic how care homes had been affected so tragically within COVID. So absolutely critical area, and this report sets out how we aim to support the care homes, and that the four key aims there are in the first page of the report. So very importantly, to make sure that we're providing residents living in care homes with access to the right social care and health care, delivering high quality personal services, in making sure that we use our resources proactively and absolutely reactively in this particular situation we're in, and reducing the need for someone to have to go into hospital, so ensuring that they could get the right care in the right place. But if they do have to go into hospital, ensuring that we supported the home so they can get back to their home. We've had a huge step up in the system here, I would say, and it's really wonderful to see how our GPs, the PCNs, have really led the way in this to make sure that we're really able to give that right clinical care. And although I constantly am saying to my colleagues, actually, this is the resident's home, we need to remember that's not a mini hospital. They would have made with their families a very difficult decision to come into this home, and that may be their last home they're in. So we do have to remember their social care rights, and this is their place. But absolutely critical, we have to recognise that many residents are frail, and they have long-term conditions, hence they're needing to go in the home. And to me, to be able to see how all their needs, both care and their health needs, are met in this setting, is really a tremendous step that we've taken forward. And I think Javina mentioned earlier that actually we're leading quite ahead here in London. I would say my observation is we are absolutely leading, and it's a great response to a very difficult situation. You know, the pandemic will move on and we'll all get back to some form of normality at some point. What's important that this healthcare will remain, actually. So it's really a tremendous step for us in Harrow. So I wasn't intending to go through all the report, but if there's anything particularly in there that you'd like to raise, I'm very happy to. I'm not sure if Ali's on the call, just to give, I suppose certainly just to give thanks to the people involved in it. So from the local authority, the Safeguarding Quality Assurance team have worked really, really hard, as with Joe in commissioning, our CCG colleagues and North West London colleagues from the CCG, and of course the PCN. So it really has been a joint approach to this. I suppose the only other thing I would just like to say is absolutely really important here is the providers as well. So we do have, as an integrated response, we do have regular meetings weekly and sometimes more with the providers to make sure that what we're doing is actually landing well with the providers and is doing what we intend to do, and that's a good feedback mechanism for us as well to make sure that they can come. So initially, as you can imagine, that was mainly around PPE and what clinical assistance providers need. That of course is moving on as time moves on as well, so that's still very important, but it's important that we work with the needs of the providers and residents as well as this moves forward. So I'm not sure, Ali, if you'd like to say anything further.
No, Angela, I think you've covered it very, very well. It's been and continues to be a really exceptional group to work with, both, you know, through the tiers of what we work on a kind of very operational basis on a weekly basis, checking and ensuring the position on each of our homes, through the work and the lessons learnt workshops that have been undertaken with all of our care providers, and then the wider, more strategic work that we're looking at the future and what does integrated frailty look like for the future in terms of both house and social care.
Thank you, Angela and Ali. Is there any questions on the report itself or any comments? Kazantha?
Thank you, Chair. Just a general question. Is the PPE equipment, I mean, is available in all care homes now? There's no shortage of anything?
Yes. So what we did find at the beginning, there was a supply chain problem. So it was difficult to access the PPE at the beginning. That settled down, and we had a lot of assistance from our West London colleagues, their alliance, who helped us secure a supply, and a huge amount of work with the CCG and the local authority distributing. We've now found that supply is more flowing. So the providers secure their own supply. We do have an emergency backup, but providers can get their own supply. And we've not had any reports of any problems with them obtaining that personal protective equipment.
Thank you, Alice. It's just good news. Thank you.
Thank you. Marie Pate.
Morning, everybody. Marie Pate from Healthwatch Harrow. No comment on the report. I thought it was really good. It was really just to raise awareness to some of the concerns that we're starting to hear through Healthwatch Harrow, which is about the restriction of rights of individuals in care homes. I think they are sort of one-off incidents, but we are hearing more than one. They tend to relate to people who have got less capacity, and it tends to be related to, I think, sometimes just lack of knowledge with some of the staff on what clients or people staying there are starting to do. We've had some feedback from Advocacy First that the advocates wanting to support clients have been refused access to care homes because of either the restrictions or whatever. So it's the work we are following up. It was just to raise awareness. So it's not about the report. I think the report's excellent, but we are starting to get some concerns about rights and restrictions. I think in many cases it's probably more about lack of knowledge than a deliberate will to restrict somebody's rights, but it is something that we're following up on. Thank you.
Thank you, Marie. Paul Hewitt.
Yeah, so I just wanted to comment in the sense that as we look forward now, in the sense that this care home support plan is there, we really cannot afford to be complacent about our care homes. This, I believe, is going to be the battleground in terms of controlling this virus going forward. They are very vulnerable and very susceptible to the virus, and the staff and workforce are key and critical to containing and controlling the virus in the second wave. So it's right that we look back and we celebrate a little bit for how we combined, but we are going to be tested again. And part of what we have to do right now is to not lose those vital lessons about the care home sector, because if the virus starts to infiltrate again into our care homes in numbers, we are talking about very serious issues and admissions to hospital and increased death rates. So yeah, it's right that we at this moment in time look at this and emphasise its absolute importance for our response for the next wave.
Thank you, Paul. We have a number of speakers. If I call them all in one after the other, and then Angela and Ali could respond at the end, would that be, is that okay? I know Ali's got her hand up, but if we do it at the end, it'll make it a lot easier. So the order is, the people are ready, is Janet Moat, Simon Brown, Simon Crawford, and Genevieve. So first person is Janet.
Thank you very much. I just wanted to say what a super report it was, and I welcomed it very much, especially as Harrow has such a high rate of LZ people, and this is something that will continue, obviously. I was delighted with the proposed pilot, actually. I really thought this was an excellent way forward to recruit 2 new practitioners who will work together to improve and coordinate care in care homes. And I think that's something that is really innovative, and it's would be really good for the care homes as well. I have friends who have relatives in care homes in Harrow, and they are very happy with the way that everything is going at the moment. Obviously, there are a lot of conflicting views, going back to what Murray said, because I think very much it's to do with lack of understanding. And I think when you have family in care homes, you are desperate to see them, to be with them and whatever. And unfortunately, these restrictions at the moment are very difficult, and it looks like we will, you know, have to go perhaps with more restrictions as time passes. But no, I welcome the report very much. Thank you very much.
Thank you, Jenny. Simon Brown, Councillor.
Yes, thank you, Chair. Yes, I just wanted to emphasise and support what Paul said about the care sector. I was going to make that point, and he's made it very eloquently. But it is true that we can't take our eye off the ball. I'm appreciative for all the effort we've done to help support care homes and staff development within care homes across a whole range of things. But as Paul says, this is potentially, again, the battlefield, and we must be prepared for it. And therefore, we must do all we can to ensure that both staff and residents in care homes do get the testing they need when they need it. And that has fallen off a little bit lately. And it really is a key point that this must get back on track. Otherwise, we might be back in the situation we were before. And the other thing is, I'm very much welcome the enhanced primary care that we're putting in for residents in care homes, because it's so important to look after the health and well-being of residents within our care homes, obviously for their own well-being, but also to help to reduce their potential admissions into hospitals, whether that be falls prevention, and I see there's work going on around that, and other items such as pressure sores, whatever it may be. But all the better and more support we can give in terms of primary care to those residents has benefits throughout the whole system. Thanks. Thank you, Chair.
Thank you, Simon. Next, Simon Crawford.
Hi, thanks, Graham. Well, one observation and a question really. So the observation is around the falls prevention. Comment on page 3, paragraph 3, page 3, around there's a range of support, rapid response teams, how this not as consistent as could be and aligned to PCNs. I just wonder whether we just need to make sure that that's picked up by the frailty work stream that we've got up and running. I know we've said we haven't done within that work stream. We've said we haven't really addressed falls, and so it's just a sort of reminder really that we really do need to pick it up somewhere and have a home for it. But the second question was around the metrics really, in terms of there's a table here. It does talk about the difficulty around collecting data, and I was just interested in what progress we've made in terms of being able to collect that data. I've lost the page now, but it was in here somewhere. Measuring successes, top of page 15. The following indicators are proposed to measure the success of the pilots around reductions of LS called out, A&E attendances, etc. So it'd be helpful to see those metrics at some point, really, because I noticed the first part of the report we have got some for 17-18 and part year 18-19, but we need to be measuring against those. That's all. Thank you.
Thank you, Simon. And Genevieve.
Thank you. So I just wanted to kind of talk to Paul's point. I think he's absolutely right about us not being complacent, and I think that this is a really important area. We have got some experience of outbreaks happening in care homes and how they've been managed to be contained. So I think that's a really key point. And I know that's not, I couldn't see it in this paper, but I know that there's a very clear plan for when outbreaks do happen, that they're tried to be contained as much as possible. And that's really, really key. I also wanted to pick up from this morning we had a Harrow governing body, and we were asked questions on care homes and really about kind of like outcomes for patients. So I think it's really important that we're all aware that we know a lot more about how COVID presents, the way that it presents, particularly in a care home setting, the importance of having good conversations with the residents of care homes, along with all of our more frail members of society, around what they want in terms of the care that they want to receive if and when they became unwell, and then actually ensure that we are able to deliver that care. So the information that we have now to give to residents is sort of different to the information we had 6 months ago. Now we understand COVID a little bit better, and I think it's really important that we, as a system, ensure that we are having those conversations afresh with our residents so that they understand how things would work if they became unwell and how we would best look after them. So you know, that each individual is completely their own unique person, and they do need to be involved in that decision making, and we just need to make sure that we take the time to do that, preferably before we get completely overwhelmed. So that's a conversation that I've had with our local GPs, and I'm sure that others are reaching out to our care home residents as well.
Thank you, Genevieve. So if we ask, Ali wanted to come in as well, and Angela. So do you want to come in first, Ali, and then Angela will then sum up the debate?
Great, thank you very much. So just in response to Marie's concern about restrictions and rights, particularly around mental health learning disabilities of patients with autism or complex needs, we have got a series of training sessions which are being undertaken by CNWL, our mental health provider, in order to work with staff to ensure that they are up to speed and understand the approach that they need to take, particularly in this worrying and concerning time. We're also looking at a much wider range of training for care home staff, with the hope, obviously, that through this period and beyond, it will also mean that we have a better retention of staff. So we're working with CLCH in terms of their academy, which is their training academy, to look at a range of areas in which we're looking to do some training. We will, however, pick up the advocate issue with the care home providers on the call, and I will come back to you on that one particularly. In terms, Simon, you talked about ensuring that we continue to have rigour. I can give you some assurance that we continue from the COVID period, when we were talking as a collective group daily. We continue to speak twice weekly, and that we are now extending the times for those conversations. We also have a daily log that we jointly own and sits on a central database, so we can all collectively see the most up-to-date data, and that records not only any outbreaks, any risks associated with staff, times of testing. So we have a really full picture of Harrow at any point in time. And we also continue to have a centralised coordination function. So if at any point a GP goes into a care home or does a virtual visit to a care home, and there is any patients with any particular deterioration, whether it be COVID or non-COVID related, we have a central coordination function to ensure that the appropriate clinical or social care support goes out into that home, and that is inclusive of local testing. So although testing is a challenge at the moment nationally, we continue to have some local ability to test when we have an outbreak. Simon, your point's very valid, and on the chat, obviously, we will pick those up in our work stream, which is on the 29th. We are already starting to make sure that we have those baselines so we can measure what success is, and we will finalise what those KPIs are going forwards.
Thank you, Ali. Angela, did you want to sum up the report?
Yes, so thanks for everyone for their observations and comments, as Ali has diligently answered all of those, but we will pick them up and reflect them in the work stream. I suppose the one thing that, just to pick up on Genevieve's point about actually how we communicate and engage with the actual residents and their families, I suppose is the one thing that it's very important that we take away. Not only for the current residents and their families, and I think Mari picked up on this as well, because it's a really high level of anxiety in families at the moment who have a loved one in care homes, but also to give some confidence for people who are considering coming into care home over the next couple of months as well. So that's a good point. So I think in summary, I would say that we're pleased to hear your observations and the confidence that you have in this report. A huge amount of people are working in the background to make sure that it actually makes some impact, and we will continue to do that.
Thank you, Angela. Just to remind people, I think, well, we all know, but it's sort of to residents, this was one of the hardest hit areas during the past the pandemic, and I saw the hard work that people put in to make sure that, you know, that we could actually control access, but it's also to make sure, try and keep people safe. We don't have as many care homes as some boroughs do, but I think the ones, as Angela says, you know, we do have a number that are actually abiding by the guidance and are being very cautious about things. Sometimes people can be over cautious, and I think we need to manage that relationship quite carefully. But we're going to come back to this in a bit later on around the local outbreak plans, because care homes is one of the key areas of concern, that if we get an outbreak in a care home, it's quite significant. And also, we're going to note the recommendations on the report, but I just remind people that this is also supports the previous plan report that we had around the out of hospital recovery plan. They're very linked together, and you know, there's a lot of good work taking place to make sure we try and keep people safe. So can we note the reports that's on the COVID report? Thank you. We got we got 4 more reports to go through. It's now 1:30, just keeping the clock at the time. So if we can now move on to report number 10, which is the Mental Health and Learning Disabilities report. I believe this is from both Javina and Paul.
Okay, so I'll just make a couple of remarks to begin with, and then I'll probably hand over to Javina and the authors of the report. But just to say that, as with a lot of these issues, COVID has shone a big light on the mental health of our population and the way that mental health overlaps a whole number of life issues. So it is important, and it has come out in various manifestations, and as we've come out of lockdown, we've been seeing the impact on mental health across populations. So it's important that we do have a focus on mental health. I mean, similarly, it's already been referenced, but that the cohort of people with learning disabilities have been disproportionately affected in terms of deaths and illness because of their underlying conditions, and they have really struggled during this time. And it's right that we have a conversation about them and their lives and how we've addressed that. So I'm just going to hand over now to Javina and then maybe to the authors of the report.
Thank you, Paul, and thank you, Chair. So just a couple of things. First and foremost, can I just say that there is an omission. We should be, the title should be Mental Health, Learning Disabilities and Autism. Autism is very much part of this particular area of focus. So my apologies for that. The second thing I want to apologise for is that we meant to circulate Northwest London mental health, learning disability and autism's recovery report. And I think in trying to get the papers out, somehow that report seems to have been missed. Our local report is actually within the context of that report that was submitted from a Northwest London perspective. It's a very comprehensive report. And so, Chair, with your permission, I just want to highlight a couple of points on that report and then bring in the authors of the report to talk about our local plans. But I think it's quite important to have that as a context. So if I may, the Northwest London report really provides a summary of the Northwest London response in terms of service provision to mental health users, learning disabilities and autism in terms of the pandemic and service changes that we put together and sort of more digital and online service provision. It sets out a list of principles which guide the recovery approach and particularly recovery in key areas of activities. And in the final sections, it really aims to set out the key areas for collective action. And so when you get this report, we will circulate it after the meeting. You will see that our local plans very much follow the same themes. The Northwest London report was actually presented to NHS London on, I think it was the back end of June. It was very well received and there were three areas, key areas of feedback. The first was that NHS London were very keen that we as a partnership evaluate the digital offer. So our work around mental health focuses on four areas: community crisis, children and young people, and learning disabilities. We've been asked to look at all of these areas in terms of the digital offer that we are making available. There was very much a focus on us doing some more work in terms of our vulnerable and disappeared children, people who have just fallen off the radar. And so there's quite a lot of focus on that. And the third area was around the health inequalities, and all four aspects of work were asked to focus on this. And lastly, we were advised to make sure that we really built on the work that the PCNs were doing in terms of the PCN related work and the interface with mental health, really looking at that whole health and care offer as one. So I think these were the salient points that I wanted to bring in terms of the context of the Northwest London report. But I'd like to invite Lenny and Seth. Perhaps Lenny might want to start and Seth to follow because they have put the report together. And I have to say that during this period, both Lenny and Seth have been instrumental in making sure that we've shone the light on the issues facing our communities of patients in these areas, and also really working very hard with the voluntary sector groups and faith organisations to make sure that we can support people as best as possible. So over to you, Lenny.
Thank you, Jadina, and thank you, Chair. I'll start with just at the time of COVID-19 back in January that we responded to the national incident level 4. It's been tremendous to work with colleagues so rapidly and closely. I would say with the local authority we had plans already, and we've been working closely along with public health. We commissioned CNWL, but their response within days of the COVID pandemic was amazing. And I work with the voluntary sector, which was ongoing. I would like just to, I know I've written quite a lot in this report, but I'd like to just add a few points, or focus on a few points with the our hospital recovery plan, especially our response to the crisis. So in CNWL, there were new ways of working, and they made new arrangements for their CMHTs and the community staff, where they ran 3 weekly rotas. That was in the older people service and the memory assessment service coming together as one. They majorly ran a 7-day-a-week service which I think was brought in almost immediately to be able to support this. And I've referenced the Mental Health Emergency Centre, which was to reduce the amount of patients that would go into A&E and in Norfolk Park, which in some respects is the busiest A&E in the country. So we've got, let alone London, so we've got quite a lot of work which was happening to support the teams there. They made estate changes at Bentley House to support service users locally, and we reviewed the majority of patients in terms of those who have been seen virtually. So there were some patients who really required to be seen face to face, but we did that after risk assessments. But the majority of patients went to virtual, so the service never stopped running. It ran all the way through. The medication systems for the hospital for CNWL remained ongoing, and that included home visits and making sure that people who had to have depot injections still had those. Patients were called on a weekly basis to monitor those. All service functions were maintained, and even into the transformation plan, which we implemented during this period, carried on, and it was delivered. COVID patients who proved to have been COVID positive were treated or within the service who could be seen, unless they had to go to the main hospital, but those were seen there, and there were no deaths for staff in the hospital. The reason I made that point is that we also are host commissioners for another hospital, which is Cigna, Harrow on the Hill, and the Cigna service across the country had rather disproportionate deaths for their staff, and we also supported that one, Cigna Harrow on the Hill, as part of our service. Harrow Community Mental Health Services, like the IAP service, they moved to a virtual service as well. Psychological support was made for professional staff, and a staff offer was given to everybody across the services, and that included professional staff working in nursing homes. And they were aware that during this period we had issues around anxiety, uncertainty, isolation, and sadly bereavement. Adult community transformation went live, as I said, on the 1st of July, and the 3 hubs which supported the 5 PCNs in Harrow were all there. We did notice changes in the physical health checks for SMIs was paused, but then we're developing a plan with our EMIS, on our EMIS system to roll that out later in the year. We have done work around what we call detox, that's to look at webinars to maintain, so we no longer have delayed transfers of care, and that's really worked well with the local authority and CNWL. When we came out with this plan, we had to deal with 3 things. The first phase, or called phase 1, but the first phase, the recovery and restoration phase, which was a second, and then we're going into the 3rd phase. So instead of going all the way through it, the first phase was really to look at Central North West London Foundation Trust as the main provider of learning disabilities and mental health services, and its immediate response to CNWL. In that, we also looked at all our voluntary sector services to look at what their response would be as well, which was very, very positive, and you'll see it through the report. We run a number of different meetings and sessions with those groups to be able to do that. And I think if I looked at just take it with the main provider, we wanted to reduce the bed capacity as set out in the mental health emergency centre. Primary care resilience was a key, care home support, community resilience, and service transition to virtual was important. To say at the same time, a lot of that work was also done in the voluntary sector and other providers. What we wanted to do is, once we had a structure and once it was up and running, we then came into what we call the recovery and restoration phase. And as we entered that phase, we looked at how we tackling health inequalities, emotional and psychological support. And there was a need to increase talking therapy services for post-traumatic stress disorder, as we say that, and bereavement. The enhanced offer for face-to-face or virtual personalised treatment was based on the need and meeting priorities across the board in terms of equity and access. And through that, we found some serious emerging themes and priorities for Harrow CCG, the voluntary sector, and other providers, where we looked at several areas, including health checks. About 20% of our users have declined digital access of service users, but wanted to wait. But now we're seeing a spike as the increase is coming back, and the numbers are coming, I won't say exactly normal, but they've raced up in terms of those for having talking therapies, but in terms of those in A&E, which went down to almost zero, has now gone to the point of where we're having blockages or overestimating numbers coming through the service, which we've developed plans for and we're meeting. Javina and the team and Paul talked about social care support and support for carers, and there are several sort of plans and meetings which are happening over this period to make sure that we continue to support them, which we have done through the pandemic. Our main issue was to manage capacity and flow. Many of the service users who were under significant pressure during the COVID period are starting back to use services. Some were temporarily paused, as we said, but where the demand is now, as we said, has increased. The executive team at Central and North West London Trust had implemented a plan to be able to support its staff and signpost people in the best area. That's to address anxiety and uncertainty, we said, providing mental health services and advice around social inclusion, including wellbeing, domestic violence, signposting and helping those to develop coping strategies, and supporting frontline healthcare workers and their families through this period. Over the last 2 years, Harrow CCG and the local authority have co-chaired an autism health and social care group. We also run a learning disabilities health and social focus group. Both these groups have a wide attendance from a number of agencies, including the voluntary sector, the statutory services, and patient and carer groups. And there is a way of working in a co-productive way to be able to address issues on an ongoing basis. And those meetings carried on through the COVID pandemic, where we were able to glean and learn new areas that we could support people in, and those areas which they saw as priorities or areas that we felt they were sharp as being an area that needed to be addressed. And we've responded to those. So as we go into what we said, phase 3, we have key priorities for August, which were to accelerate the return of non-COVID services, expand and improve our mental health service, restore and expand the services to IAPT, and run a 24-hour, 24/7 crisis helpline, which are all in place. So I think I'll leave it there and take any questions, or let Seth raise any issues he'd like to raise. Thank you.
Thank you. Thank you, Lenny, for that in-depth presentation. Seth, did you want to add anything?
Yeah, thank you, Leader. Yes, I would like to. Just to add to what Lenny said, I think Chris Miller's got his hand up, but should I go first, or should I?
Yeah, if you want to go first, then we open it for questions.
Okay, brilliant. Thank you. So thank you all for allowing us to present this updated report, shared information. So yeah, the LD and ASD service leads have worked, collaboratively throughout this very difficult pandemic period across health and social care. Lenny and myself, we meet monthly to look at, all the key issues and discuss solutions with our partners at CNWL. People with learning disabilities and ASD have experienced a really difficult and challenging period during the lockdown. We've reduced access to services and access to the community, due to the complications for them dealing with social distancing and being able to social distance safely. So the LA and CCG have worked closely with other agencies, including the VCS, faith groups, and providers to use local intelligence to ensure no one is forgotten and neglected. This collaborative approach has allowed us all to get through the very difficult last 6 months with some level of stability and reassurance that we are understanding the key issues facing disabled children and adults with learning disabilities and autism and their carers. So as integrated services and jointly, we've looked at a lot of the main key issues, and as part of our COVID response, we've been reviewing home care and care home support, making sure they're supported with information, guidance, interventions as required. sharing and circulating information and guidance and being flexible with critical support where needed. We have maintained full Care Act responsibility during the pandemic, which has not always been possible for other LAs. I think that's been quite good locally. Our integrated LD health and social care services have transitioned to pretty much a virtual with limited face-to-face contact due to obviously the concerns around COVID, but we've managed to make sure everybody is seen and contacted and reviewed and assessed as we would normally do. So needs are met as we would normally do. Local authority has been providing food deliveries, support to schools and bereavement support in addition to the COVID helpline, which is still working. And we've been doing lots of telephone contacts and follow-up so that people can be reassured and tell us about any concerns that are developing. As Lenny mentioned, the pandemic obviously has raised a lot of issues around inequalities in health and social care for people with LD and ASD, and we've been having a lot of thought and reflection of how to manage that. Significant deaths across LD, across Northwest London. I think last year, April, the numbers was about 31 deaths around the same time. And I think in this year, we've seen about 141 deaths in the same month across Northwest London. We are using the letter process to make sure that we're monitoring and reviewing these cases and learning any particular lessons, if there are deaths that could have been avoided in particular. We've also seen referrals going up for young people with behavioural issues who are struggling to be maintained in the home, family home. We've also done a lot of work with the voluntary sector and having a very joined up approach around how we go back into, if you want, business as usual, recover from the lockdown period. And families are still obviously concerned and worried about trying to get back to a business as usual approach. But as Lenny said, we have a health and social care focus group for learning disabilities and autism, which gives us the opportunity to hear firsthand what the concerns are and to discuss solutions and how we can progress the agenda and make sure people are well supported and heard. Also, on the context of autism, as Javina referenced, we've commissioned some additional support from a specialist ASD service that will liaise with citizens and carers, and where necessary provide some therapeutic support and input, which I think that's helped quite tremendously across the year, across the last 6 months in particular. And we also had a refreshed ASD pathway that we launched last year, and we've found that's kind of closed the gaps where possible, so there's less impact and people falling through the gaps, which was a previous concern. So we tend to find that we're picking up these set cases a lot quicker, and in particular being able to address the main concerns. So what we're finding is it's a stable and good picture. Obviously can be improved, but we're pleased with how we managed to respond to this very difficult time during the COVID period. Thank you.
Thank you very much, Seth. We're opening it for questions and comments, brief questions and comments. Chris, you did have your hand up earlier.
Yes, hopefully I still have. I've got two questions. Thank you, Seth. I wasn't aware of this huge uptick in the number of leader deaths, and I had a question about leader before you made your point about they've gone from 30 something to 140 something. We only have 5 trained leader reviewers, I think, in Harrow. And some of those find it hard to do reviews. So how are we going to manage that if we are actually going to follow the leader process? And there's a strategic thing about that, so somebody may want to pick that up. And I've got a question about section 136, which I think is, you mean the Mental Health Act, which is the police taking people suffering from mental health from public places, and you're taking them to a specialist hospital, which is great. Are they languishing at police stations a long time before they end up at their new hospital destination? So the leader one and the section 136 one, thank you.
So if I start with the leader one, Lenny, you might want to add after that. So we've managed to expand this year the people that would be trained for leaders. So previously the number was 5. We're looking at around 20 now across the health and social care integrated team. So most of them have had access to the training facilities because it's an online mechanism. So they're working through with that with our colleagues in the CCG, Christine, who's mainly leading on it. And the plan is that we'll have more capacity to address the leader deaths. The local number is actually lower. So that 141 is the Northwest London number. the local number, I think Lenny's around, is it 5 or so?
It was 11.
11, okay.
Yeah. That was the point I was going to make. Yeah, that was a North West London number. And on Leader, we've done quite a lot of work on Leader, especially during the COVID period. So we brought out a thing called the rapid review. So normally you do the Leader review is quite a long review. And the rapid review was just to capture that information during the COVID period, which we did do. So that's why we knew our numbers were at that level. Yeah, I don't. There is a planned change in terms of how we've going to accelerate the work of the Leader. So that's being worked on right as we speak. So I'll probably bring an update at some later meeting for you.
Thank you. Can we just invite Tanya in to answer that question, because it's quite a key question around section 136.
Certainly, yes. I'd be happy to. So as far as the 136 question is concerned, just to be clear, at the moment, Northwick Park doesn't actually have a 136 suite. We have two 136 suites over at the Brent base. What's happened over the last few months is CNWL have pulled together their resources with 136 suites. We have a number of suites over in Hillingdon, and also we have suites at the St Charles site. We do now have more suites than we previously had. But what would happen if there is a request from the police to bring somebody into 136, into the 136 suite? The police phone our central flow hub, which is a team based centrally. It has oversight in all our beds throughout the system and all our 136 suites. So they will be able to direct the patient to a 136 suite within CNWL. At times we have to go external to CNWL beds, and that will happen. And at times, obviously, if a patient has physical health problems as well, they may well get diverted to A&E to make sure they're physically deemed fit before they actually go into a 136 suite. So that's the situation. On occasion, I wouldn't say languishing in 136 suites. Very, very infrequently will we have a patient when we've been really, when we've had some major referrals coming in very rapidly, and that tends to be when lockdown started to ease. We had a real spike in referrals into A&E. We've had patients in a 136 suite, but it's been very, very occasional.
No, so the question wasn't about languishing in hospital suites where one feels they're safe. It's whether in fact there's any use anymore of police cells to hold them until they get sort of triaged on, because that's stopped now, has it?
Maybe I wasn't clear. I said very, very occasionally. I think I remember one over the last COVID experience when there was a service user in a police cell during that time, because we were unable to move them because of their acuity.
But the default position is that they get taken directly to a medical place where they can be properly assessed, and they're not in a police station. Okay, thank you.
Thank you. We have two hands up, which is Gazantha first and then Christine. Did you want to ask them both? Gazantha, if you want to ask your question. Then
yes, thank you. Very quick question. I'm sure they're running out of time. On page 107, recovery and restoration, I just noted that quarterly monitoring is on hold. Is it because of COVID, social distancing, or any reason? Are we going to, start again? Is it going to affect any of your work?
Shall I take that? It has started again.
Lenny, but if Christine could ask her question, and we'll sum up at the end after picking all these points up. Christine, did you want to ask yours now?
Thank you. Yes, thank you, Leader. It's more of a comment, really, and I'm on a kind of theme today. I know that the good, strong partnership we've got between the CCG and providers and the local authority is very much focused on the needs of children and young people. I know that. And on page 112 of what I'm reading, I can see about children's and young people's community-based services. I know about our excellent commissioning of Power Horizons. I know about the future projects which are coming on board, and I'm really thrilled about that. It's just you would never know from reading this that there was something called complex level children's services, or that there was such a thing as CAMS. And I'm only mentioning this as a very slight admonition, because those of you who know me will know I spent 20 odd years arguing for children's services to not be forgotten, because when people start mentioning mental health, they automatically so often just switch into thinking about adult mental health. So this is just for the future, and just to say that I know it's there, I know how hard we're working, but it's not mentioned. Thank you.
Thank you, Christine. So there's no more questions or comments. Did Lenny and Seth want to pick up the questions that are raised? Lenny, you said you can respond to Kazantha's point.
Yeah, the quarterly hold, it was NHS England agreed that during this period they had put most of our quarterly reports on hold, or pause was the term, but to be picked up after that. But that has actually started already. One of the reports went in, it was midnight last night, so they've all come back online now, and we have to pick them up. But I think it's just during the COVID period they felt that, do you really need to be having this information at this time? The work carried on and people still collected the data. The second point, I think it might have been Carol's report on page 112. We in mental health we take CAMS and children's services.
Christine, you're on mute. I'm sorry to say.
Oh, bless you. That must be, is that a first, Geraldine? In terms of somebody managing to make me quiet. Sorry for that. It's just everybody automatically slots into adult mental health, Lenny, that's all. And so it's not a complaint, it's just a slight nudge. I know it's there, I know we work well together, I know there are future plans, but they're all more or less at tier 1, and it would just be, I'll shut up now. Thank you for that, Genevieve.
Thank you. So we now move to the recommendations on the report. We actually note the report today. Is that agreed? I can see people nodding assent. Due to the time, it's now 2 o'clock. Can I propose that we move to item 12, which is an important report, because I think some people have to leave quite soon. So if we could move to item 12, which is the local outbreak plans and the update on the contained framework. And that is from Carol and Lawrence. Is that agreed? Yes? Nod? No nodding? Up and down nodding. That's good. So side to side nodding. So Carol, are you there?
I am here. I'm just scrolling through the previous strategy that I had ready. Right. Okay. Yeah. So every local authority had to create an outbreak control plan and publish it by the 1st of July. So we squeaked in with a data spare. And this plan sort of fits in with the contained framework. It's underpinned by rapid testing at scale, which we know is a bit of an issue at the moment. The test and trace programme to identify people who are contacts, to contain outbreaks and to minimise the spread, and to enable people to make informed decisions about their behaviour and about going to work and their economic restrictions. So what we've done is we've taken this plan and created our own local plan, which focuses on the 7 themes that we were asked to focus on, which was care homes and schools, high-risk workplaces, communities and locations, mobile testing units and local testing approaches, contact tracing in complex situations, data, vulnerable people and local boards. And I've done a slide on each of these as part of the plan. Underneath all of this, we have action cards for each of those particular settings, which give a bit more detail about how we're actually going to approach it. I think I have to say that this plan is it's a developing plan, and the action cards are certainly developing. So as more information comes on, we get examples of good practice that differ from what we're doing. We're amending our plans as time goes on. In terms of underpinning the plan, we're looking at all of the data that we've got, trying to understand who's being affected and why, what we can do about it. Our communication strategy, we've got a huge communications remit to try and get those messages out there and to reinforce the messages in communities that are not paying attention to them, which there are pockets of people in the community who are obviously not social distancing and not wanting to wear masks. What we're trying to do is to target some of the work at them, and also there's other parts of the community that just haven't been engaged with this, and so we've been working a lot with different parts of our local community. So we have a project, as has previously been mentioned, with the Somali community, with the Tamil community, with the Romanian community, and also with the Black African and Caribbean community. And with each of them, we've been working on a sort of co-production of local videos and resources that are specific for their community, so they can address some of the issues that concern them. The testing capacity, as I've said, is an issue. It's a national issue, and it's a bit beyond our local control to solve that. We do keep making recommendations and feeding our concerns up nationally. We believe that there's a big lab coming on track in the next month, which will reduce the waiting times for tests and increase the capacity for the throughput of tests. So it's not a case previously where we've had problems with the reagents for testing. It's actually just a lack of capacity. The labs are overwhelmed with the numbers of tests that are coming through. We are looking at how we can put local testing sites. We're currently working on a testing site that will be in South Harrow, and that will be a walk-in testing site. We're working on contact tracing, the National Test and Trace programme. We've got around 80% of the cases identified in Harrow have been successfully contacted by the test and trace, but that leaves 20% of people that haven't. So we're looking at developing a local test and trace system, which will have public health and environmental health officers working to talk to people and collect that data, and then we feed that back into the national system for them to contact all the contacts of those people. We will also be looking at this new policy that was announced late last week around trying to support people who are currently self-isolating and ensuring that they're following the guidelines, and also making sure that they have everything they need to be able to self-isolate. As from next month, that will also include financial support for people who are on benefits and in certain other categories. We At the moment, we're not facing a particular local lockdown. What we're facing is a tightening of the local the powers nationally, and we're looking at what we can do in London to try and improve things so that we don't actually have to go into another lockdown. I think I'm probably going to finish there, apart from to talk about the governance. So the governance of the situation is we have a health protection board. Within that health protection board, if we have any outbreaks, we have an incident management meeting, which we've been having on a weekly basis for the last month as the cases have been increasing. And the Health and Wellbeing Board is the board that we are reporting into. So what we plan to do is we'll do a regular report for the Health and Wellbeing Board for each meeting about where we are on COVID, what's actually been happening, and what the situation is in terms of test and trace and outbreak management and things like that. We also report into PHE and to the Regional Oversight Group, and we get information from the Joint Biosecurity Centre to do our local analysis. So I think I'm going to finish there and answer any questions that anybody's got.
Thank you, Carol. There's a couple of hands have gone up. I just also made the point that the government app is being launched on Thursday, and businesses will have to, the part of the announcement late on Saturday night, I think, was that businesses have to display the QR code, which before was just advisory, but now is going to become enforceable. But it's also this, the testing capacity has been increased, and we think that's what the Prime Minister is going to announce tonight. In the northern counties of actually paying for their own testing capability just to meet demand, and I think that's what the government's now picked up on. So the testing will improve, we hope, but we live here in that's where we are. There's two questions. I've got some comments at the end, but if we just move to Genevieve, then we have Kazantha.
Thanks, Graham. So Carol, I mean, I know a lot of work goes into this, and I know we all want this to be a real plank in our defence of how we manage this for another surge. I suppose for me, I know that in North West London we also have a kind of like a North West London surveillance group, which puts together all of the different information around North West London, and we as Harrow feed into that through your own office. But I suppose the question for me is, we are a borough that borders Hertfordshire, as well as bordering the rest of North West London, as well as bordering North Central London. So how do we make sure that we get the correct data from those areas, so that we are really getting a plan from our surrounding aspects, given that COVID isn't respecting any borders?
Yeah, we have a London-wide plan as well as the Northwest London plan, and that should be published fairly shortly. I've been the DPH lead on that for with Kevin Fenton and lots of other good people. So that's looking at our outbreak plan for London. So I get data every day about what the situation is in all of the other London boroughs. So I am checking what's happening in Barnet and what's happening elsewhere. What we don't get on a regular basis is what's happening in Hertfordshire. So we've been developing a communication system with Jim McManus, who's DPH in Hertfordshire, and is very good. And he's been telling us about the outbreaks that they've had around St Albans and around Watford, where they had a lot of young people coming back from Greek holidays. And yeah, so there was a joint outbreak control meeting there a few weeks ago, which we were invited to as well. So we do have a contact, but we're not routinely getting their data in the same way as we get London data, because we're in different PHE regions. But we are sharing everything that's happening across borders, and looking at the rates. And I certainly check all of the other boroughs in North West London for their rates, and I read their exceedance reports if they've got them, just to see whether there's something that's likely to be bordering on our area. So if we sort of look at the Edgware corridor and Barnet and Brent, if all of us have got issues around that sort of Burnt Oak area where we all join, then we need to have an incident management team that covers the 3 boroughs and what we're going to do across borders, rather than just sort of looking at it as a Harrow particular issue.
So just to go back onto that though, I do think that, I mean, Hertfordshire, as you said, it's had its own issues, and it certainly struggled last time in the same way as North West London did. We are far more similar to the south of Hertfordshire than we are actually to Westminster, to be honest. So it's just really a kind of like a slight anxiety I have.
Yeah, me too. Yeah.
Just as an observation, just on this point, we had a cabinet meeting last week, and it's quite a good layout of how we move from level 1 right through to level 4 and the interventions that take place. And that sort of sets some of that data out. And I think what we will do is request improved access across Hertfordshire. Carol's already got the links, so maybe we could push that a bit further. What we've got to remember is we've now been moved to level 4 already. So we was in level 2 or level 1B the other day. Our numbers are low enough to be in level 1. But we're moving straight to level 4, and that brings in some extra.
That level's a different level 4, Graham.
It's slightly different on.
So our levels is looking at our local rates, and at the moment we're in somewhere between 2 and 3 probably. 2 and 3. I don't think that we're quite at the level 4, although we may be in London as a whole approaching that. But the level 4 pandemic plan is the national plan, which is their 5-point plan. It's tiers and pillars and all sorts of things getting
Pillars have been quite of this concern, but I'm making the point that we're moving into an area where the freedom of information will flow a lot better.
Yeah.
People are sort of been told now that we can share data a lot easier across boroughs and boundaries. But we'll pick that up. Gazumpha, you had a question. Gazumpha, you're on mute, I think. You're on mute, Matt Gazumpha.
Yes. Can you hear me now? Yeah. Thank you, Chair. Thank you, Carol, for this report, and also particularly weekly update we get from you. It's not a question, my only a bit of request or suggestion. You mentioned the Somali and Romanian community, but in Harrow we got Afghani communities and the Sri Lankans, Pakistani, Indians. I think my suggestion is to educate these communities. If we can have the leaflet printed and leave those other places of religion like mosques, temples, and churches, synagogues, I think that will help to educate the communities in case there's a second wave and there's a spike again in infection. So this is my suggestion. I'll leave it to you. Thank you.
Yeah, we have multilingual information in I think it's 34 different languages that have been produced by the Doctors of the World group, and it's really good information that's routinely available for everybody about test and trace, about signs and symptoms to look out for, about what it means to self-isolate. So there's lots and lots of multilingual information out there. The work we've been doing specifically with communities. So I've been doing workshops with the voluntary sector as a whole, and then we've been doing some targeted work with certain communities that we know have particular issues around accessing services and about understanding some of their local issues. So, for example, with the Somali community, producing something as a leaflet is not considered to be a good idea because they're a very oral society. So producing a video for them was thought to be, from their community perspective, a much better way of targeting their community. So they've produced a poster which has got a QR code on it. So you scan that QR code and it opens YouTube and shows you the video. And then they've since gone on to develop a couple of other videos from the work that we've been doing, which is about myth busting. So if they find that something comes up in their community where people are spreading messages and they come to us, they ask us what the truth is on this, and we tell them, and then they go back and they do a bit of myth busting with their community. So it's been really good work. I've really enjoyed working with people and trying to get the right messages out. I think we need to do some of that myth busting in English as well.
Karen, my suggestion is, I mean, like if you give the information to like Cairo Central Mosque for the Muslim community, Islam Center and Stanmore Mosque, they got their own websites. If you can provide this information, they can put in their websites.
Yeah, sure.
So that's, I think, if you need any help, send me an email, so I'll get in touch with on your behalf. So we can put all this information on their websites.
Yeah, I think with Alex Dewsnap, we're working with the Multi-Faith Forum as well, so that they can get things out to across the different faith groups as well. And I think we have a meeting with the Jewish community, I think, next week as well.
I mean, anything you need help, I'll speak to Alex for Islam Center in North Harrow or Harrow Central Mosque across the council. I'll be available. If you need to send me an email, so I'll just involve these people.
Okay.
Thank you.
That's great. Thank you.
It's just to point out that part of the communications plan that's been developed, sit behind what Carol's doing, does bring in these videos which are being recorded at this moment in time, and they will be available for distribution. We're putting them in as many languages and using as many community leaders as possible because they're recognised within the community, so we can sort of show we've got a joined up conversation taking place. Janet, you've got your hand up.
Following on from that, with the rule of 6, I think it's so important because weather was so good, there have been reported to me groups of ladies of 12 or more with all their children in the park having picnics. And I think, unfortunately, people don't realise that the rule of 6 means children as well as adults. And I know it's all been very confusing for people, but I just feel that it needed to be pointed out. The weather probably is going to change now anyway, so there won't be people having picnics, but it might be worth emphasising the rule of 6 means children as well. And even if you're outside in a park, you can't have more than 6 people. You can't have 12 ladies and all the children, as one unit. So it just needs to be simplified and explained. Thank you.
And I think also while we've been meeting, the Minister has been making a statement in the House about tightening up some of the regulations. And we're looking with the Mayor of London about tightening further in London as well. So we're waiting for the final messages to come out. But yeah, that is something we'll be doing. I think the Harrow People is going to be taken over with another COVID edition. So we'll be making sure that we get all of those messages in there.
That's lovely. Thank you very much indeed. Thank you.
Yes, just to say as well, on a national leaders call last week with Mr. Hancock. That point was made all over the country about the rule of six. Six friends can meet up, but 6 family members from 3 households can't. So it was too confusing. So he has stated that they're going to start tightening up that messaging this week. But maybe that's what Mr. Johnson's going to do this evening on his call. Is there any other questions that we have? No, I just think the reports we've gone through so far have shown how we can work well together when we're in a sort of a crisis of a pandemic, and it shows that what Carol's just setting out is how we're going to deal with the crisis going forward, and all these reports are very closely interlinked for that reason. You know, we've learned a lot. We know what doesn't work, and we might do things slightly different to other people, but that's because of the makeup of the borough. But we know that professionally, the people who are involved professionally through their experience and you know, training will make sure we're going in the right direction, or they will raise something if we think it's out of kilter. We know we've got the messaging that needs to get out. The key messaging we've put out ever since this pandemic is to follow the Public Health England advice, and we haven't wavered from that position, which is to make sure you're social distancing, wearing a mask and things like that. But it's also something that we're progressing quite strongly through communications going forward. But by reading reports, I think we have to publish these reports more widely, because even on all 3, and it's something Seth said in the middle of the mental health and learning disabilities report and autism reports. You know, we've learned a lot, and we are struggling at times because of capacity within different organisations. But I think we've got the experienced people there that can actually take it forward. So it gives us confidence, I think, to lead into what Carol was just talking about, the local outbreak plans and how we're going to move forward if we do get an outbreak. It does mean we've worked well together in the past, and we will definitely have to work harder going forward. But we've also, within this group here, got an escalation process through the executive, which Paul Hewitt and Javina lead on, to make sure that we can resolve things very quickly. So if anyone's got any issues, just raise it through the normal teams. That also involves the voluntary sector, and is also contacts through to the other organisations that it's good to see them actually on the call today. So we have the CNWL, but we also got the other groups that are very welcome to be here and have made such a difference to the people of Harrow. So the recommendation is on the report. As there is no other questions, the recommendations on the report is that it's information only. But I just think it's a living report, isn't it? We're going to learn from things. Yeah. It's going to move forward. So is that all agreed, or did you want the final word, Carol?
No, I'm we just like the endorsement of the group on the report, and we'll keep everybody informed with regular updates, and the messaging that we want you all to keep passing on to anybody and everybody that you come into contact with.
Thank you. We now move. We have 2 reports left. Item 11, which is the health and wellbeing strategy with obesity strategy as an appendix, and we have item 13, which is the public health quarterly reports, Q3 and Q1. I'm just going to ask Paul's advice on how we present these.
Okay, so I think the 2 quarterly reports are in there for information. They are very rich, and they need to be in the papers. But I think we can take them as read. I think it's important that we do endorse the health and wellbeing strategy, because it has been updated in the light of COVID. It was based on some very key partnership work around the joint strategic needs analysis, and the obesity plan in the appendix is a key plank to our response to health inequalities in Harrow, and we are using the health and wellbeing strategy as a theme in the borough plan. So I think it's important that we endorse it, even if we don't have time to fully explore it, and Carol may be able to do it in staccato fashion in a way that I can't.
Yeah, I'm happy with that. The quarterly reports are there for information. We've done one looking at how we use the public health budget, and the second one was a review of the first wave of COVID. Yeah, they're more information reports. On the health and wellbeing strategy, I just wanted to introduce everybody who hasn't already met him to Lawrence, who's our public health consultant. And he can take us very quickly through health and wellbeing strategy and the obesity plan, and make our request.
Okay, thank you. Excuse me. Thank you, Carol, and thank you, Chair. I will briefly cover both of these reports. The first thing I'll say is that the health and wellbeing strategy is, of course, a statutory requirement, and hence the desire to have that endorsed at this board. It is something that was originally planned to be presented back in March. So, as Paul mentioned, it's been refreshed, and we've added the COVID implications throughout it. It aligns with the borough plan, the council's borough plan, and of course the aims of the ICP. It should echo much of what we've heard so far today, to be honest. The high level plans are outlined on page 143, and they are to reduce health inequalities, to have a focus on prevention, to improve emotional well-being, and to ensure an integrated approach to care. So those high level plans have been further assessed across a fairly common format, the life course. So this is starting well in life, living well, working well, and aging well. And each of those sections have been allocated a responsible director, and those directors are across the council and the CCG. So that reflects the cross-partnership work. There are a series of impact measures on 144, which we can track our progress against. I'll pause briefly there in case there are any other questions, else I'll go straight into the obesity plan, which again, as Paul mentioned, is a key plank of the health and wellbeing strategy.
Does anyone have any questions at this moment in time? No one's indicating. Do you want to carry on slightly, Lawrence?
Okay, I will do. So obesity, I have to give the context. 54% of adults in Harrow are either overweight or obese, and that's 8% obese. It's also a risk factor for severe infection, COVID infection, provisionally 2 to 4 times more likely in the under 65s to be admitted for intensive care. Risk factor for diabetes, again, approximately 80% attributable to type 2 diabetes. So the monitoring of this action plan is completed by the Harrow Obesity Stakeholder Group, and a key role of that group will remain alert and to respond to any grant allocations as they become available, because they are becoming available, and respond appropriately and make bids for these funds. There are 3 main parts of the plan, which I'll draw to your attention, is to strategically address our obesogenic environment. So that in effect is addressing health impact assessments for new developments, improving access to open places, encouraging green travel, and that sort of thing. The second main area is how the information on services and support is pulled together and coordinated across all our partners. So this is particularly involves work with our early years settings and our schools. And the third area is to ensure that the tiers for weight management are appropriately understood and followed. So this is particularly the Tier 2 weight management services. So this is these are the services that are delivered in the community and typically commissioned by the local authority, and the Tier 3, which are clinician-led, multidisciplinary team led, and they're typically commissioned by the CCG. So it's ensuring that those 2 tiers of support and services are well coordinated and understood through our partners. One of the key asks of the both the health and wellbeing strategy and the obesity plan is that we're looking for a counsellor or counsellors and likewise GPs to become health food champions. So this would be a key link for us in rolling these plans out. Somebody that we can routinely interact with and hope to support the actions in the plan. I think I'll leave it there.
Thank you, Lawrence. I did forget that part about the counsellor role. I don't think I'd be a very good role model with my diet feeling. I think everyone's been involved with developing the strategy, which has been very useful. We've had some very good conversations about developing it. It's a pity we can't get more time into it today, but I think everyone's on board with the direction of travel. I think we will need to get back to you with the names of counsellors, and I suppose Genevieve and Javina will be able to get back to you around the GP side of who would lead from that point, and then we can just sort of start moving that forwards. Does anyone have any questions or comments at this stage? Genevieve?
Just want to say, I absolutely think it's a laudable aim. I just think that, in fairness, I can't load anything more on GPs at this specific moment in time. So please bear with us.
Yes, we do accept that and understand that part of it all. We might find a very good chef. We could leave it.
Genevieve, we are taking this as part of the prevention work stream as well. From so we have got sort of MENA as a potential supporter for it.
Thank you. We've got Janet and then Javina.
Thank you. Yes, I just want to say what a very good report it was, and especially in emphasising the obesity, which is so important because it has so much life implications with diabetes, and diabetes in Harrow is quite high. I think it's probably one of the highest in the country as such. So, and that obviously has lots of health implications. Now, one of the things I was really interested in is I wondered if we could go along the lines of providing recipes or certain foods that people could eat. It's so important because years ago in schools, we all know that we did domestic science, we did all sorts of things in the primary school as well as in the high school. And I think in lots of cases, people do not know how to cook basically, and it's so much easier to pick up a takeaway or to pick up something from the supermarket that you just throw in the oven or the microwave. So it's trying to change that mindset really of how to cook real food doesn't take as long as what people might think. And apart from eating fruit and vegetables and all of this, but it would be a good emphasis to put through. Thank you.
Thank you, Janet. And we had Genevieve. Oh, sorry, Javina. Javina put her hand up and it's gone again.
Sorry, Chair, the point had been covered. I wasn't able to take it down quick enough.
That's okay. So thank you very much. Just on Janet's point, I think the lockdown has proved when people are cooking at home, the amount of food they're actually throwing away with the separate food waste collection, people are actually seeing that. And we've tracked that through the whole of West London now, and people are doing better. It's quite fortunate that this is recycling week and we're focusing around food waste. And you'll see lots of little menus turning up across a number of social media platforms to try and show how people can eat more healthier. Lawrence, did you want to pick up anything I might have missed on that report, or Carol?
No, I think I've mentioned everything and had good discussion, so it's all been good.
So, as a board, before we move on, can we actually? This is one we forgot to approve. So, can we approve the health and wellbeing strategy? Is that Christine putting her hand up, or is that supported? Oh, Chris, supported. So, if we can approve the strategy and we will get back to you with the names for people who would be sort of champions around the food strategy, part of the element of the obesity strategy. Is that agreed?
Mm-hmm.
Excellent. We've got a few minutes left, so did you want to go into the public health quarterly reports very quickly? Anything to draw out that's quite urgent, or
no? I mean, I think it, it's one of the things that we have been asked about a number of times, which is about how we use the public health grant. And so I wanted to take that as a theme for one of the quarterly reports, and we'll try and do this every year so that people can see very explicitly how the public health grant is actually being used. It shows you how much has been spent on the services that we contract, the drug and alcohol, sexual health, health checks, and the 0 to 19 public health nursing services, and how much is being used on the wider determinants of health. And from the different partners within the local authority, we also have the outcomes that they've been using, because we have to justify why the grant has been used, and make sure that it meets the conditions, that it is about health improvement. What we've also been able to do is from the public health reserve, which still has the same grant conditions, we've been able to use that as one-off funding to either pump prime projects or to deliver a time-limited project. So if we go back in the agenda where we were talking about the care homes work, one of those posts that is supporting care homes is actually funded from the public health grant. So, I think that's a really good example of how we can use the grant to move things on in terms of care homes, provide evidence base so that we know that it's something that works in the future. So that's really all I wanted to say about it. I think the report, is fairly comprehensive in how it's being used. We're just collecting the data for how the outcomes that we did for last year, and we'll present that at a future meeting. But if there's any themes that anybody would like us to cover in terms of a quarterly report, then please sort of drop me a line offline, and we'll try and do some themed reports as well. Oops, you're on mute, Graham.
I am. Thank you. I was just wondering if there's any questions or comment, but I'd like to make a comment at the end. But is there any questions or comments? No, the comments, I think we've seen the pressure that public health has been under for some time, but I think the COVID-19 has shone a spotlight on the way that public health can actually change underlying underlying health issues, going to start addressing those underlying health issues that have been badly affected by people through COVID-19. When we spoke about the obesity strategy is one of them, but it's also around some of the other ones you've talked about, the spoken one, quite effects on mental health. And a lot of those are all coming together. So we need one of our asks of government at the moment, when we went out to a survey around what councils need, apart from everything else, we did put quite a challenge in and back around properly funding public health going forward, because it's shown that early intervention in this area has a major impact when you come to sort of really serious situations that we face ourselves. So,
yeah, I mean, I'd just like to sort of say thank you, a big thank you to my team, because they, in the same way that the GPs and the NHS have delivered services in new and novel ways, so have the public health services been delivered. So, we've been doing our partners in sexual health have been doing online requests we've been doing, we have a new pilot for a weight management programme that is a virtual programme rather than a face-to-face programme, and that's been going quite well. So we've done lots of things, and the team have managed to keep most of the work going in some way, despite the pandemic and despite sort of reporting and supporting the pandemic efforts as well. So yeah, thank you to my team. You're all brilliant.
Thank you, Carol, and thank you, Loves. Recommendation is we note the report, and I think we've done that. I haven't been notified of any other business, but Paul was just reminding me that we do have our next meeting scheduled for 24th of November, and quite frankly, we don't know what position we're likely to be in. Whether we are, it might be quite a busy time, or we might have time to do it. So I think we need to be quite flexible if necessary around if we need to move the dates, but also some of the reports. We're not expecting great tones to come through to talk about some of the issues going on, but we might have some, might be worthwhile at the least just to have the meeting to sort of give a general update across the health partnership about how we're going through any challenges we might be facing. Would that be okay? So I'm saying we keep the date in the diary. We try and work around our other appointments around it. If we can do reports, we will, but if not, we would just sort of use it as an opportunity to update and make sure we're on going through. I think one thing I've learned through this pandemic is by having these conversations and finding out what's going on, it's actually showing that we're not on our own through the pandemic itself. So we meet as London leaders as an arm and say you meet, CCG meets across London as well, and it shows we find out what's going on, we learn from each other, and maybe we need to bring that together at this board if necessary nearer the time. So we'll leave the date in the diary, and if we can do reports we will, and if we can't we won't. Yes, I'd like to have 3 cheers for the public health team. Well done, Carol and colleagues. But I'd like to thank everyone for attending today. I know some people have had to drop off because of other meetings. I've got to go straight on to another one now as well. It is very busy, but I do thank you, sincerely thank you all on behalf of all councillors. I can say that part for the work that you've done through this pandemic so far. And we support you going through the next stage of it as well. Thank you very much. See you all soon. Thank you.